morning. My name is Kimberly Dawes, and I'm here today to do a physical assessment. The first thing that I'm going to do is I'm going to leave my patient's room so I can come back and knock, and I can enter, and I can shut the door for privacy or pull my curtain.
Come in.
Hi, my name is Nurse Dawes, and I'm here today to do a physical assessment on you. Could you tell me what your name and date of birth is?
My name is Kamari Fields, and my birthday is April 26, 2007.
All right, so the first thing I'm going to do, Ms. Fields, is I'm going to wash my hands, and I'm going to apply some gloves, and then I'll check it against your armband to make sure that you are who you say you are, okay? So, wash my hands. I would do the happy birthday song if I was in the hospital, but wash my hands, and I will get these gloves off the wall in a box or at the bedside, so I'm pretending that that's where they came from. Okay, my gloves are applied. So may I see your armband? This is Kamaya Fields. Her date of birth is 4/26/07. Kamaya, the doctor has ordered a physical assessment on you, okay?
Okay.
So are you comfortable with sitting up on the side of the bed? Because I want you to be very comfortable when I'm doing this physical assessment.
Yes.
Okay. Do you need any help sitting up on the side of the bed?
No.
Okay, well, could you sit up on the side of the bed for me? Okay. The first thing I'm going to do is I'm going to assess your level of consciousness. Could you tell me what your name is?
Kamaya.
Do you know where you are?
At the hospital.
What time is it?
10:40 something.
Okay. That is correct. She's alert and oriented ×3. Are you experiencing any pain at this time?
No.
Okay. Her speech is clear. So, since we assess her level of consciousness, I'm going to check her pupils to make sure that they're equal and reactive to light activity. And I'm going to do this, Miss Fields, by using my pen light, okay? All right. Can you look at me? Okay. Her pupils are equal and reactive to light activity bilaterally. Can you tilt your head back a little bit because I want to look in your nose and your mouth to check your mucous membranes. Okay, could you open your mouth? Her mucous membranes are moist and pink with no signs and symptoms of dehydration noted. Now what I'm going to do is I'm going to listen to your heart, and it will normally be skin to skin, but I'm not going to do skin to skin because I'm not going to raise her shirt up. If we were in any type of medical setting, we would do skin to skin. When it comes down to her heart, when it comes down to her lungs, her abdomen, everything will be skin to skin. So I'm going to first do her heart. I'll be doing aortic, pulmonic, tricuspid, and mitral. Aortic, pulmonic, tricuspid, and mitral. Her heart rate is regular, is strong, and she has no murmurs noted. So now we're going to listen to her lungs. Anterior lobe first. Her anterior lobes are clear bilaterally. Her respirations are even and non-labored. Now we'll proceed to the lateral lobes. Could you raise your arm for me? Okay, could you raise your other arm? Her lateral lobes are clear bilaterally. Now we will proceed to her posterior lobes. And after I do her, listen to her lungs on the posterior side, on her back side, I will lift her shirt up. I will assess her buttocks. I will be looking for any wounds, any drainage, any swellings, or any abnormalities. But I'm not going to pull her shirt up and do that because we're not in a medical setting. But could you turn around, Miss Fells, so I can listen to your lungs on the posterior side? And I need you, when I get ready to, you can put your legs on up in the bed and turn all the way around for me. Thank you. Okay. When I listen to your lungs behind, I want you to take some deep breaths, okay? Could you take a deep breath for me? Okay. Could you take another deep breath? Okay. Another deep breath. Okay. Another deep breath. Another deep breath for me. Another deep breath. Last deep breath on this side. Okay. Take another one. Deep breath. Miss Fells' lungs are clear bilaterally. Okay. Could I get you to turn back around for me? And what we're going to do is we're going to go ahead on and we're going to assess her upper extremity movement and her muscle strength. All right. Could you press your hands against mine? Okay. Could you squeeze my hands? Great. Miss Fells has strong muscle grip. She has strong muscle upper extremity strength, and she has very strong hand grip. Could you move your arm? And she can move her upper extremities freely with no restrictions noted. So I'm going to look at any edema in both of her arms. She has no edema noted. And while I'm looking at her upper extremities, I'll be looking for any wounds, any type of bandages, any drains, any type of IVs, any ports. She don't have any of that. So Ms. Fells is free of that. Let's check your capillary refill. Capillary refill less than 3 seconds. We'll check the other hand. Capillary refill less than 3 seconds. So now I'm going to check her skin turgor. Her skin turgor is very prompt. It's springing back in less than 2 seconds, and I'm going to check it on her chest. Skin turgor is very prompt, springing back less than 2 seconds. So now what we're going to do is I'm going to feel your pulses. I'm going to do your radial, I'm going to do your brachial, then I'll do your carotid one side at a time. Let's do your radial. And I'm just going to let you see radial. And I'm going to do both of them together, but I don't know how good you can see them in the video. Okay, give me that hand. Her radial pulses are normal with a normal rhythm, 3+ score. And we're going to do brachial. Brachial pulses. I'm just going to show you the one on the outer side. But I'm going to do both of them at the same time. Her brachial pulses are normal with a regular rhythm, 3+. And I don't know if I said that her heart rate was normal with the regular rhythm and she had no murmurs. If I didn't, I'm saying it now. And we're going to do the carotid one side at a time. Could you tilt your head a little bit so I can palpate your carotid pulse? Okay. Her carotid pulse is normal, regular rhythm, 3+. And I'm going to check her carotid pulse on the other side. You kind of tilt your head a little bit. Okay. Her carotid pulse is normal on this side, regular rhythm, 3+ score. Okay, so we did the upper extremity. We did the upper extremities. We did the capillary refill, skin turgor. We checked for drains. I asked you about any pain. I look for an edema. You can move freely. So now what we're going to do, we did the lungs and the heart. I'm going to get you to lie down because I'm going to do your abdominal assessment at this time. Are you comfortable with laying down?
Yes.
Okay, well, could I get you to lay down? And what I would do in a hospital setting, you're going to scan, you're going to stand on the distal and proximal end, and you're going to look for any asymmetry. You're just going to kind of put your legs down, baby. You're going to kind of get down and you'll be scanning. You'll be looking for any asymmetry on her abdomen. And no asymmetry is noted. You'll be looking for any pulsating masses. And then we know if we see a pulsating masses, we don't touch that. We let the doctor know immediately. Because we could have abdominal aneurysm. But we'll be looking for anything out of the abnormal. So, since I did my scan, now we're going to auscultate each quadrant. And then I will proceed to light palpation of each quadrant. Alright, we're going to start with the right upper. And we'll listen for 1 to 3 minutes. If we don't hear anything, we'll do like additional 2 minutes. But our bowel sounds are very active. We're on the left upper, left lower. I hope you can see. Left lower, right lower. Okay, her bowel sounds are very active. So now what I'm going to do is I'm going to do light palpation to each quadrant. And I'm going to start with the right upper. Let me know if you feel any pain or discomfort. Any pain or discomfort?
No.
Okay. The left upper, any pain or discomfort?
No.
Left lower, any pain or discomfort?
No.
Right lower, any pain or discomfort?
No.
Okay, no pain or discomfort noted. Since we're on your abdomen, what we're going to start, we're going to do your health, wellness, and maintenance activities. Tell me about your bowel movement. When was the last time that you had a bowel movement?
Yesterday.
Okay. Was your stool hard? Was your stool soft? Did you have diarrhea? Was it normal?
Normal.
Great. Tell me when is the last time you urinated?
Today.
Today, was your urine clear? Was it white? Was it yellow? Did you have any pain or burning?
It was clear.
Great. And also with your, it's good that you having a bowel movement, that you had a bowel movement yesterday. But tell me, how often do you have a bowel movement?
Every 2 days.
Great. If you proceed to go over 3 days, then you need to consult your nurse at your doctor's office or consult your doctor because you could be experiencing some type of constipation. And the doctor may want to put you on a stool softener. He might want you to come in. So as long as you're going within that 3-day period, you're good. Tell me, how's your diet? How do you eat, Mrs. Fields?
I eat salad.
Great. Continue to eat your salads because we want to introduce those green leafy vegetables. We want to introduce that fruit, that fresh fruit. Also the fresh veggies. We want to introduce that lean meat because the lean meat is good. We want to do the fiber. Make sure we keep our fiber intake up, and it's very good for our intestines and for our colon. And we want to also get at least 6 to 8 glasses of water in per day. Tell me, do you exercise?
Yes.
How often do you exercise?
Every day.
Great. Continue to exercise every day. It makes your heart very happy. It's good for your heart. At least do 30 minutes of exercise at least 5 days a week. All right. Do you do self-breast exams monthly?
No.
Okay. Well, it's very important for me to teach you to do self-breast exams monthly at least 7 days after your menstrual cycle. And the reason for that is early detection of any type of breast cancer or any type of lumps. Do you smoke?
No.
Great. Do not smoke. Smoking is the #1 cause of lung cancer. So, great. What about alcohol? Do you drink any alcohol?
No.
Great. Alcohol is bad. Alcohol causes all type of issues, abdominal issues. It can cause you liver issues, cirrhosis of the liver. You can also have liver cancer. Great. All right. So, since we did all that, what I'm going to do now is I'm going to scan Miss Faye's lower extremities, okay? And I'm going to scan her lower extremities for any type of edema. And what I have to do, Ms. Martin, is move this tripod back a little bit so you can see me scanning her lower extremities, so you can see me doing her pulses and her feet, popliteal, and all that good stuff. So I'm going to move the tripod back because I'm using this tripod. Okay. So I'm going to scan. She has no edema noted. And I don't know if you can see that, Ms. Martin. No. She has no edema noted. I'm going to check her capillary refill. Capillary refill is less than 3 seconds. I'm going to check her cap refill, and I could be checking them at the same time, but I'm going to check them one at a time so you can see me, and I'm going to come around here and check the capillary refill. And it's less than 3 seconds. So now what I'm going to do is I need to do the pulses, and I'm going to kind of tilt the tripod a little bit for dorsalis pedis pulse is the first pulse that we're going to palpate. And I'm going to do both of them at the same time. Her dorsalis pedis pulse is normal with a regular rhythm, 3+. We're going to do the posterior tibialis pulse next. And I don't know if you can see that. I'm going to do one at a time so you can see it. Her posterior tibialis pulse is normal, 3+, grading. And I'm going to do the other one, but I'm going to do both of them at the same time since you saw me do one. Okay. Both posterior tibialis pulses are normal, regular rhythm, 3+ grading. I'm going to test her lower extremity movement and strength, muscle strength right now. Could you take your feet and could you press it against mine? All right. Her muscle strength is strong. Could you move your legs for me up and down? She can move both of her bilateral lower extremities. She can move both of her bilateral lower extremities with no restrictions noted. Okay. So now I'm going to come around, and what I'm going to do is I'm going to check her popliteal pulse. Okay. And let's go behind the knee. And if you experience any pain, any tenderness while I'm palpating your popliteal pulse, please let me know. Are you experiencing anything?
No.
Okay, and the reason for me asking is because that could be a sign of a blood clot. I will also take and look. Her popliteal pulses are normal with a regular rhythm, 3+. And I will also look for any redness, any swelling in the calf area, any pain, because that could indicate a blood clot. So that's the purpose for asking that. Her femoral pulses we know are here, but we're not going to do the femoral pulses. We're just going to let you know what the femoral pulses are. Okay. So now, I think we covered everything. Let me tilt this. Okay. So we did the lower extremities. We did the dive. Are you comfortable?
Yes.
Okay. So since you're comfortable, what I'm going to do is I'm going to cover you up. I'm going to let the side rails up. I'm going to put your collar light in reach, and I'm going to lock your wheels. But what we did forget to do is your deep tendon reflexes. And you really need a little hammer to do that. But I'm just going to kind of go through the motions myself. Could you sit up for me before I do all that? I know I did all that, but let me... So the deep tendon reflexes, you're going to have to come over. Come on over some more. Okay. Really, you feel that kneecap. Hold on. Let me tilt the tripod again. Okay, what you do is you feel this kneecap. And you're going to take the hammer and you're going to hit right below that kneecap. But I don't have a hammer, but that's how you do your deep tendon reflexes. So this pretty much concludes the video. Let me get my patient position. Are you comfortable? Can you lie down and I can cover you up? And as I stated, I'm covering her up. Her wheels are going to be locked. Her collar is in reach. Her bed is in the lowest position. And her side rails are up time too. I would document this physical assessment. And before I go into the hospital to choose my physical assessment, I will prioritize it according to my medical diagnosis. Thank you, Mrs. Martin.